Hi, my name is Kamsi Martina Aloze. I am a pharmacologist and a certified nursing assistant. I'm an applicant for MSc Adult Nursing Pre-reg at GCU. First question: why do you want to become an adult registered nurse? Please tell us about any relevant experience that you have. For me, I would say that this is one of the most enticing questions because from childhood, I've always loved to become a nurse. It has always been my desire. It has always been my dream. And I've worked with people that care for others. There, I discovered that I derive joy in caring for other people. And I also discovered that I can develop a strong relationship quickly with them. So my desire for nursing has actually made me to work in health sector for the past 5 years. I work with nurses and doctors, assisting the nurses in various duties like checking and recording the patient's vital signs, lifting and transferring patient from bed to wheelchair, from bed to stretcher, administering their daily oral medications to them, bathing and feeding the patient, dressing the patient, dressing their bed, and following the proper procedures of hand washing and many other duties. Second question: what are the most important skills and qualities you possess that will make you suitable for nursing? For me, nursing is a career for courageous, competent, and caring individuals that are capable of developing a relationship with their patient quickly. And drawing from the CCs of nursing, which are compassion, competence, courage, care, commitment, and communication. I believe I possess all these qualities. Yes, I believe I possess all these qualities, and it has been evident in my few years of experience in health sector. So I'm of the belief that I'm very qualified for this nursing program. For instance, I'm someone that cares for people with compassion. I care for people with commitment. I'm someone that is wholly committed to their patient and their needs. And this makes me to kind of connect well with them, thereby enhancing mutual understanding and communication. Third question: please explain what you understand as being the role of the adult registered nurse. An adult registered nurse is one that is empowered to see to the needs of all the patients suffering from various illnesses, ranging from minor injuries to severe ones, could be acute, chronic, or long-term diseases. And I also say that an adult registered nurse share a greater line of communication with patients. What I mean is that an adult registered nurse are the most reliable link between the patient and the doctor. So I would say that an adult registered nurse are the main contact to the patient, although they usually work with a multidisciplinary team. So even an adult registered nurse, they may also have the contact of the patient family. That's particularly in a situation whereby the patient suffers from chronic illness, and may be returning for treatments regularly. Also, an adult registered nurse, they contribute to the patient recovery by providing a care plan, and they also gain confidence and trust of the patient, and they respond to emergency quickly, and many other roles of an adult registered nurse. Fourth question: can you think of a team situation where your communication skills have been essential? Please tell us more about the situation and how you contributed. Something happened in the past, an incident where I worked. So a woman had an accident and it affected her right leg. So because of that, she was unable to work, and I was assigned to her. So I discovered that introducing exercise to her would be beneficial. So I told her about it, but she was resistant at first. So she was resistant. But in the course of the discussion, I realized that her major fear is the pain. So I tried everything possible to convince her that I would do. I tried to convince her that I would do everything possible not to inflict more pain. So at the end of the discussion, she accepted to do the exercise. So, but seeing that she's a plus size woman, extra hand will be needed for the exercise. So I involved my team. Yeah, I involved my colleague. I told them about the exercise, and they agreed. So we started the exercise. It was a daily one, and we did it in twos. So, but we discovered that she, at the end of 4 months, she was back to her feet. She was able to walk without any cane. She was back to her feet as her normal self. So it was a great joy to me, to my team members, and to her, the patient. That was it. 5th question. How do you think adult registered nurse could show compassion and empathy to patients like myself? In response to that question, an adult registered nurse is pledged to provide care with compassion, with empathy. So for me as an adult registered nurse, it's my responsibility to provide care with compassion and with empathy. For empathy, I would say that I'll try to see myself in the shoes of the patient. I'll try to put myself in his shoes. I'll try to see myself in his state. So, but I'm of this belief that sincere compassion can only be shown by clear communication. So for patients with such disability, I'll have a heart-to-heart talk with the patient, and by doing so, I'll be able to know and understand the level of his disability. And I can also show compassion, for a person that has been very mobile, can walk by himself, do so many things, doesn't need assistance to do some things, to do many things, but now he requires help to do even the most simplest of things. For such person, he is also affected both emotionally and physically. So what I'm trying to say is that his emotional state is also affected. So giving the person some words of encouragement may go a long way to brighten their day. And for empathy, like I said earlier, I'll try to see myself in the state of the patient, so I can show empathy to such patients, to the patients with such disability, by trying to make myself available, trying to give them a helping hand and assistance in so many duties that they are not able to do by themselves. Yeah, I believe that with this point I have given so far, to the best of my knowledge, I believe I've been able to tackle the questions. Thank you.